Before you crack open a single egg this morning, I need you to stop and hear what I'm about to say. Not because eggs are dangerous, they are not, but because the way millions of seniors in this country are eating, storing, cooking, and, most critically, timing their eggs is quietly doing damage that most doctors never connect to breakfast. There are 7 mistakes being made in senior kitchens across America every single day. And the frightening part isn't that they're hard to spot. The frightening part is that they look like the right thing to do. They look like a responsible breakfast, a healthy choice, the very routine a caring doctor might applaud. But here's what makes mistake number 1, the one we'll reach at the end of this video, truly alarming. It has nothing to do with how the egg is cooked or stored. It involves something sitting on your kitchen counter right beside your breakfast plate. Something millions of seniors do within minutes of eating eggs. Something that could be quietly making one of your most important daily medications nearly useless. Stay with me until the end, because once you understand what's happening, you will never go back to your old routine. My name is Dr. Nathan Cole, and here at Wellness Daily, my work is simple. I take the research buried inside medical journals and translate it into language that actually changes what happens in your kitchen. I've spent years in clinical practice working alongside patients well into their 70s and 80s. Careful people, diligent people, people who show up to every appointment, fill every prescription, and genuinely try to eat well. And eggs are almost always part of their routine, which makes sense. Eggs are extraordinary. The choline in the yolk is one of the few dietary sources capable of protecting the brain networks responsible for memory and clear thinking. Networks that begin to thin after 60 in ways that don't always announce themselves until the damage is already done. The B12 supports the myelin sheath, insulating every nerve in your body. The lutein and zeaxanthin in the yolk guard against macular degeneration, the leading cause of vision loss in adults over 65. The complete protein profile preserves the lean muscle mass responsible not just for strength, but for balance, stability, and your ability to stay in your own home. All of that is real. All of that is the reason eggs deserve a place in your morning. But the 7 mistakes I am about to walk you through can silently cancel out every one of those benefits. Not dramatically, not overnight, quietly, over weeks and months and years, in ways that look exactly like normal aging. We're going from 7 down to 1. The last one is the one that will stay with you. Before we move on, drop your name and your state in the comments below. I'd love to know who I'm talking to today. And if you're watching this for a parent or spouse, tell me that too. Now, let's begin. Mistake number 7. Cooking your eggs in a scratched or worn non-stick pan. This one receives almost no attention in mainstream health content, and it deserves a great deal more. Non-stick cookware, the kind coated in polytetrafluoroethylene, known as PTFE or by the brand name Teflon, is in virtually every American kitchen. Convenient, practical, and when it is in good condition and used correctly at appropriate temperatures, it is generally considered safe for cooking. The problem sits entirely in that phrase, when it is in good condition. When non-stick coating is scratched, chipped, or worn, and most pans in regular household use develop exactly this kind of surface damage over months and years, those degraded areas can release microparticles of the coating directly into your food during cooking. At high heat, particularly above 500 degrees Fahrenheit, the breakdown accelerates significantly. The compounds released include perfluoroalkyl and polyfluoroalkyl substances, known as PFAS, a class of chemicals that research has linked to disrupted hormone regulation, impaired immune response, and reduced kidney filtration capacity. That last consequence matters enormously for seniors because kidney function declines naturally with age. A body working with reduced filtration is less equipped to clear these compounds, and accumulation over time is the mechanism of concern. The fix costs almost nothing and takes 30 seconds. Hold your non-stick pan up to a light source and look at the surface. Scratches, flaking, discoloration, visible wear. If you see any of these, replace it. A stainless steel pan, a cast iron skillet, or a high-quality ceramic-coated pan will serve you better, last longer, and will not introduce compounds into the eggs you are depending on to protect your body. Mistake number 6. Drinking coffee or tea during your egg breakfast. Most people reading that sentence are already preparing to disagree. Coffee and eggs go together. They always have. That is precisely why this mistake gets made by so many people so consistently for so many years. Here is what the nutritional research shows. Eggs contain non-heme iron, the form of iron found in plant and animal foods outside of red meat. Non-heme iron is less efficiently absorbed than heme iron to begin with, which means your body is already working harder to extract it from the food on your plate. What most people do not realize is that the polyphenols and tannins present in both coffee and black tea form insoluble complexes with non-heme iron in the digestive tract. When that binding occurs, the iron is not absorbed. It passes through your body entirely unused. Research published in nutritional science literature has found that drinking coffee alongside a meal can reduce non-heme iron absorption by as much as 60%. Tea produces a nearly identical effect. This matters more after 60 because iron deficiency in older adults presents not as a single dramatic symptom, but as a slow, quiet erosion, fatigue that gets blamed on age, cognitive slowing that gets attributed to getting older, reduced immune resilience that shows up as illnesses that take longer to resolve. Nothing obvious, nothing that points to breakfast. The correction is not complicated. Move your coffee or tea to at least 45 minutes after your egg meal. Pair your eggs instead with a small glass of water and a source of vitamin C, orange juice, bell pepper, strawberries. Vitamin C does the opposite of coffee. It actively enhances non-heme iron absorption. One timing adjustment. A real difference in what your body actually extracts from food you are already eating. If you're still with me and finding value in this, type the number 6 in the comments. Let me know you're here. Mistake number 5. Cooking eggs in vegetable oil or margarine. This is the fat choice that was taught to an entire generation as the responsible one. Swap out butter, use vegetable oil, choose margarine over saturated fat. The science behind those recommendations has since been substantially revised. The habit for millions of older adults has not changed. Here is what happens at the molecular level. Polyunsaturated fats, the dominant fat in corn oil, soybean oil, canola oil, and most margarines, are structurally unstable at cooking temperatures. When you cook eggs in these oils over medium to high heat, the fat undergoes a process called oxidation. Oxidized fats produce compounds called aldehydes and lipid peroxides. These compounds, consumed regularly, have been associated in clinical research with increased systemic inflammation, the same low-grade, chronic, silent inflammation that contributes to cardiovascular disease, joint deterioration, and cognitive decline over years. The irony cannot be overstated. You chose the oil that was supposed to protect your heart. In the cooking process itself, it may be doing the opposite. The switch requires no significant effort. Cook your eggs in extra virgin olive oil, grass-fed butter, or ghee. These fats are structurally more stable at typical cooking temperatures. They do not oxidize in the same way, and several of them carry documented anti-inflammatory properties that work alongside the egg's nutritional profile rather than quietly undermining it. Mistake number 4. Throwing away the egg yolk. For decades, the yolk was the part of the egg that health-conscious people avoided. Dietary cholesterol, saturated fat. It was portrayed as the dangerous component that responsible seniors should limit or eliminate. Egg white omelets became a staple of the health-aware breakfast. Separating eggs at home and discarding the yolk became an act of discipline, not deprivation. The science has moved significantly since then. The yolk has not followed in most people's minds. Here is what lives in that yolk. Choline, critical for memory, for liver function, for the structural integrity of every cell membrane in your body, is concentrated almost entirely in the yolk. Vitamin D, the nutrient most commonly deficient in adults over 60, linked to immune regulation, bone density, mood stability, and increasingly to cardiovascular protection, is in the yolk. Vitamin A, vitamin E, the complete spectrum of B vitamins, including B12, the nutrient essential to nerve health and red blood cell formation. Lutein and zeaxanthin, the antioxidants your retinas depend on for protection against macular degeneration, all of it concentrated in the yolk. The white contains protein, valuable, essential, but nutritionally incomplete without what the yolk provides. The 2015 to 2020 dietary guidelines for Americans removed the long-standing numerical limit on dietary cholesterol after the evidence no longer supported restricting it for healthy individuals. If you have been eating egg whites out of a habit formed in a previous decade of nutritional thinking, the conversation worth having is not with the internet, it is with your physician about your specific cholesterol profile and medical history. For many people over 60, the answer they receive may genuinely surprise them. Mistake number 3. Eating eggs without a source of vitamin C in the same meal. This is about how nutrition works as a system, not as a collection of individual foods. The iron in your eggs does not operate in isolation. It operates inside a digestive environment that can either support or block its absorption, depending on what else you have consumed in the same sitting. As I mentioned earlier, eggs contain non-heme iron. Non-heme iron absorption is dramatically influenced by what accompanies it at the table. Vitamin C, ascorbic acid, converts non-heme iron into a chemical form that intestinal cells can efficiently capture. Research consistently documents that consuming vitamin C in the same meal as non-heme iron increases absorption by 2 to 3 times in some studies, 2 to 3 times from the same food, with the same amount of iron present, simply by changing what is on the plate beside it. Most seniors eating a standard egg breakfast, eggs, toast, perhaps coffee, are receiving no absorption support at all. The iron is there, the gut cannot take it in efficiently. And the slow depletion that follows shows up not as a diagnosis, but as a dimming of energy, of sharpness, of physical endurance, quietly absorbed into the accepted story of growing older. The correction is almost embarrassingly simple. Half a glass of orange juice with breakfast, a few slices of fresh bell pepper, strawberries, tomato on the side, any real source of vitamin C consumed in the same meal. The iron your body was always physiologically capable of absorbing will now reach your bloodstream. If you have made it this far and this is genuinely helping you, type the number 3 in the comments. Mistake number 2. Not knowing that one of the most commonly prescribed senior medications is silently depleting the very nutrients your eggs are providing. I want to speak to you here the way I would a patient sitting directly across from me in my office. If you are taking metformin for type 2 diabetes, and there are tens of millions of Americans over 60 who are, there is something your prescribing physician may not have communicated to you clearly enough. Metformin reduces glucose production in the liver and improves insulin sensitivity. It is effective, it is widely prescribed, and for most patients it is well tolerated. But long-term metformin use is clinically documented to deplete vitamin B12 by interfering with its absorption in the small intestine. This is not a rare side effect noted in fine print. Studies indicate it affects a meaningful proportion of long-term users, and the depletion develops slowly over months and years, which means it can be well advanced before it appears on a standard blood panel. B12 is essential to nerve health, to red blood cell formation, to the cognitive function you depend on every single day, and eggs contain B12. But here is what most people never hear. If metformin is blocking your capacity to absorb B12 through the digestive pathway, the B12 present in your egg breakfast is not reaching your nervous system. You are eating it. You are not absorbing it. The numbness, the tingling, the fatigue, the mental fog. These symptoms, frequently attributed entirely to diabetes or to the natural process of aging, sometimes carry a nutritional component that goes completely unaddressed, because no one connected the medication to the breakfast, to the deficiency, to the symptom. The answer is not to stop your medication. The answer is to ask your physician at your very next appointment to check your B12 level specifically, not a general panel, a B12 level. Ask whether a sublingual or injectable B12 supplement, which bypasses the absorption interference metformin creates, is appropriate for your situation. That one conversation could change a great deal. Mistake number 1. Taking your morning medications at the same time you eat your eggs. This is the mistake that produces the most visible shock in patients when I sit down and explain it. Not because it sounds dangerous, because it looks like the most responsible possible routine. You wake up, you take your medications exactly as prescribed, you eat your healthy egg breakfast, you do everything right, and yet, for several of the most widely prescribed medications in senior medicine, eating eggs within 30 to 60 minutes of taking the pill can reduce the drug's therapeutic absorption by a clinically significant amount, in some cases not by 10%, by 30, 40, or 60%.
Levothyroxine, the thyroid replacement medication taken by tens of millions of Americans, the majority of them women over 50, requires a completely empty stomach.
The absorption mechanism levothyroxine depends on is directly competed with by food in the digestive system, particularly food containing calcium, fiber, or fat. Eggs contain all three. A senior taking levothyroxine and then sitting down to an egg breakfast within 30 minutes may be absorbing a fraction of the dose they believe they are receiving. They feel persistently tired, mentally slow, unusually cold, heavier than they should feel, and they assume the thyroid condition is progressing, when in fact the medication is simply not reaching the bloodstream at the level it was prescribed to reach. Bisphosphonates, medications like alendronate, prescribed for osteoporosis, must be taken with a full glass of plain water on a completely empty stomach, with the patient remaining upright, and with no food consumed for at least 30 minutes and ideally 60 minutes afterward. Calcium-containing foods, including eggs, can bind to the medication in the digestive tract and render it nearly inactive before it is absorbed. A woman taking this medication to protect her bone density and then eating eggs within the window may be receiving almost none of the therapeutic benefit she believes she is getting. Her bones are not being protected the way her prescription was intended to protect them. Certain antibiotics, particularly fluoroquinolones and tetracyclines, are chelated by calcium and certain proteins in the digestive environment. Both are present in eggs. The antibiotic prescribed to resolve a urinary tract infection, a respiratory infection, a skin infection, it may be partially neutralized before it reaches the bloodstream in sufficient concentration to do its job. I am telling you this not to frighten you. I am telling you because it is real, it is documented in pharmacological literature, and it is almost never clearly communicated at the pharmacy window or during a standard appointment. The correction does not require changing your medications, changing your breakfast, or upending your morning. It requires one thing: read the instructions on your medication bottles, not just whether to take with food or without, but the specific timing guidance. Call your pharmacist and ask directly, does this medication have an absorption interaction with calcium, protein, or fat? How long should I wait before eating after taking this? For most of these medications, a 30 to 60-minute window between the pill and the breakfast plate is entirely sufficient to protect full absorption. Your medications cost money. They require effort to obtain and take consistently. They are one of the most active ways you are protecting your health every day. Make certain your body is actually receiving them at the level they were prescribed. 3 things to do differently starting tomorrow morning. First, set a phone alarm 30 minutes before your usual breakfast time. Take any medication that requires an empty stomach the moment that alarm sounds, not when you are already standing at the stove, before you get there. Second, add a source of vitamin C to your egg breakfast: half a glass of orange juice, a handful of strawberries, a few slices of bell pepper. Do it consistently and let your body absorb what your eggs have always been offering. Third, if you take metformin, ask your doctor at your next visit to test your B12 level specifically. Mention that you have read research connecting long-term metformin use with B12 depletion. Ask whether your level warrants supplementation. That conversation takes 2 minutes, and the answer could be one of the most useful things to come out of an appointment you were already going to attend. Before I close, I want to say something sincerely, not as a legal disclaimer, but as a physician who means it. Everything in this video is designed to work alongside the care you are already receiving from your doctor, not to replace it. If you are managing a chronic condition, bring what you learned here to your next appointment. Show your physician. Ask how it applies specifically to your history, your medications, your lab results. General guidance, no matter how carefully researched, always needs to be filtered through the person sitting across from your doctor, and that person is you. Eggs are not your enemy. Chosen correctly, cooked properly, timed thoughtfully, they remain one of the most protective foods available to your aging body. The goal is never to eat less of them. The goal is to stop making the invisible mistakes that prevent them from doing what they were always designed to do. Which of these 7 was completely new to you? And which one were you already making without realizing it? Tell me in the comments. I read every single response, and what you share there shapes what I create next. If something in this video is going to change your morning routine, type "it's changing" in the comments below. That one small shift, one meal, one morning, one new habit is how real lasting health is built. Take care of yourself. I'll see you in the next one.